and every other players or stakeholders. We are all keen into that strategy to ensure we are achieving the results we are looking for.
In his remarks, the facilitator, Chiku Ibuka from Civil Society for the Eradication of Tuberculosis in Nigeria, said this approach represents a fundamental shift toward patient-centered care.
Community-led monitoring is an approach that empowers the affected communities to be able to monitor the service delivery and service provision in their communities, and also utilize those information to improve the general services entirely. The approach aims to track service availability, acceptability, accessibility, and quality of those healthcare services. In this context, it's going to be TB and GRTB services, and also looking at the stigma-related discrimination and human rights-related issues and barriers that are stopping people from accessing services. These issues, when identified, are going to inform advocacy within the community. And through that advocacy, individuals will be engaged to be able to address all these issues that are stopping people from accessing TB, DRTB services, and also help improve the general TB program starting from Kano State and extending towards the entire country, Nigeria.
In his statement, Dr. Sulaiman Musa Kopa, Program Officer from TB, Leprosy and Bully Ulcer in Kano State Ministry of Health, highlighted critical aspects of patient tracking. Dr. Kopa, on behalf of the Honorable Commissioner of Health, Dr. Abubakar Labaran Yusuf, officially announced the guarantee of medication availability of TB and leprosy in the state.
You know, currently there is a global cut down in funding. And even as at that, you see the National Tuberculosis Program, you know, in collaboration with the states, tuberculosis program are actually doing everything possible to see how we can work together to tackle this menace. Because I call it menace, because a situation whereby a particular patient is diagnosed for TB and then there are no medications to place those particular patients that have been diagnosed on TB medications. So that one is a major problem. So, and I think, as I speak to you now, in Kano State, there is TB medication in our DME. So that is to say, all patients diagnosed have a high chances of being placed on anti-TB medications.
The training bringing together community-based organizations, TB survivors, health workers, healthcare providers, and partners to fast-track patient cure rate and ensure complete treatment support. It has been Aisha J. Ahmad reporting for Post Time Nigeria.